Uterine cancer, also known as endometrial cancer, is a type of cancer that begins in the uterus, specifically in the lining known as the endometrium. It is one of the most common gynecological cancers, affecting millions of women worldwide. While it can occur at any age, it is most commonly diagnosed in postmenopausal women. Early detection of uterine cancer significantly improves survival rates. Understanding risk factors, symptoms, and preventive measures can help reduce the likelihood of developing the disease and ensure timely medical intervention. What is uterine cancer? Uterine cancer is characterized by the uncontrolled growth of abnormal cells in the uterus. These cells can invade nearby tissues and, if left untreated, spread to other parts of the body. Types of uterine cancer include endometrial cancer, the most common type, originating in the lining of the uterus, and uterine sarcoma, a rarer and more aggressive form, developing in the muscle or connective tissues of the uterus. Uterine cancer is categorized into 4 stages. Stage 1, where cancer is confined to the uterus. Stage 2, when cancer spreads to the cervix. Stage 3, where cancer extends beyond the uterus but remains within the pelvic region. And Stage 4, when cancer has metastasized to distant organs such as the bladder, rectum, or beyond the pelvis. Understanding the causes and risk factors of uterine cancer can help individuals take preventive measures. Hormonal imbalance, where excess estrogen without sufficient progesterone can lead to an overgrowth of the uterine lining, increasing cancer risk. Obesity and lifestyle factors, as excess body fat leads to higher estrogen levels, which raises the likelihood of uterine cancer. Poor dietary habits and a sedentary lifestyle also contribute to risk. Genetic and family history, with a family history of uterine, ovarian, or colorectal cancer, increasing the risk of developing the disease. Lynch syndrome, a genetic disorder, is associated with a higher risk of uterine cancer. Age and menopausal status, as the risk of uterine cancer increases with age, particularly after menopause when estrogen levels fluctuate. Endometrial hyperplasia, a condition in which the endometrial lining thickens abnormally, sometimes progressing to cancer. Diabetes and insulin resistance, as women with diabetes have an increased risk due to insulin resistance and hormonal imbalances. Use of estrogen therapy without progesterone, as hormone replacement therapy using only estrogen without progesterone can elevate uterine cancer risk. Polycystic ovary syndrome, or PCOS, leads to prolonged hormonal imbalances that can increase estrogen levels and uterine cancer risk. And finally, exposure to tamoxifen or radiation therapy, as tamoxifen, a drug used for breast cancer treatment, can slightly increase the risk of uterine cancer, and radiation therapy in the pelvic region also raises risk levels. Symptoms and diagnosis. Early warning signs include abnormal vaginal bleeding, especially postmenopausal pelvic pain or discomfort, unexplained weight loss, and pain during intercourse. Common symptoms are heavy or prolonged menstrual periods, bleeding between menstrual cycles, and blood-tinged vaginal discharge. Medical examination and screening involve a pelvic exam, where a doctor examines the uterus for abnormalities, and an ultrasound, particularly a transvaginal ultrasound, which helps assess the uterine lining. An endometrial biopsy involves examining a sample of uterine tissue for cancer cells. Additionally, a procedure called dilation and curettage, or D&C, is used to collect endometrial tissue for further analysis. Preventive measures include maintaining a healthy weight, as obesity is a major risk factor for uterine cancer. A balanced diet and regular exercise can help maintain a healthy weight and reduce risk. A balanced diet and nutrition should increase the intake of fruits, vegetables, and whole grains, while reducing the consumption of processed foods and red meats. Incorporating foods rich in antioxidants and fiber is also beneficial. Regular physical activity, such as engaging in 30 to 60 minutes of moderate exercise daily, can help regulate hormone levels and reduce cancer risk. Managing hormonal levels is important for women with hormonal imbalances, like those with PCOS, through medical treatment or lifestyle changes. For the safe use of hormone replacement therapy, or HRT, women should discuss risks with their doctors and opt for combined estrogen-progesterone therapy if necessary. The importance of regular medical checkups cannot be overstated, as routine gynecological exams and cancer screenings can help with early detection. Avoiding risky medications and treatments is crucial. Women taking tamoxifen or undergoing estrogen-only therapy should have regular medical evaluations. Finally, screening and early detection are essential, especially for women with a family history of uterine cancer, who should undergo early and frequent screening tests. Lifestyle modifications for prevention. Dietary recommendations include consuming a diet rich in fiber and phytoestrogens, which are found in soy, flaxseed, and whole grains. It's also important to limit sugar and processed foods to avoid insulin resistance. For exercise and physical wellness, engaging in strength training and cardiovascular exercises is crucial. Maintaining an active lifestyle with simple habits like walking and yoga can make a big difference. Reducing alcohol and smoking is another key factor. Limiting alcohol intake and avoiding smoking can significantly lower cancer risk. Managing stress and mental well-being is also essential. Practices like meditation, therapy, and support groups can help manage stress, reducing hormonal fluctuations linked to cancer. Treatment and prognosis. Treatment options include surgery, specifically a hysterectomy, which is the most common treatment and involves the removal of the uterus. Radiation therapy is used to destroy cancer cells or shrink tumors before surgery. Chemotherapy is administered when cancer has spread beyond the uterus. Hormonal therapy is used for hormone-sensitive cancers. When it comes to survival rates and prognosis, early-stage detection has a high survival rate of over 90%. Advanced stages have lower survival rates but can be managed with aggressive treatment. Living with uterine cancer. Coping mechanisms and support groups can be incredibly beneficial. Joining cancer support groups can help individuals navigate emotional and physical challenges. Emotional and psychological well-being is also important. Counseling and mental health support can improve quality of life. Post-treatment care and lifestyle adjustments are necessary as well. Women in remission should continue with regular medical follow-ups and adopt a healthy lifestyle to prevent recurrence. Conclusion. To summarize the key points, uterine cancer is a serious but preventable disease. Understanding risk factors and symptoms can lead to early detection. Lifestyle changes and medical screenings play a crucial role in prevention. As for final thoughts on prevention and awareness, spreading awareness about uterine cancer can help women make informed decisions about their health. Early diagnosis and proactive lifestyle changes remain the best defenses against this disease.